CF doesn't, CF doesn't really impact on my life because I've always been brought up with the mantra, you know, you live with it, it doesn't live with you type thing. So like I'll be able to play rugby on the weekends, go training, you know, weekdays, run around the field with my friends at school, well, when I was at school. Yeah, I've never really let it hold me back. I know that's a bit thingy, but it never, you know, has managed to stop me from doing anything that I've wanted to do.
How do you sort of incorporate your day-to-day sort of treatment into life?
In order to incorporate the treatment, I have to get up earlier. So my friends and everything will be going, oh yeah, get up at 7, go to school. I'll be like, oh, I have to get up at 6:30. Things like that to fit it all in. And then like now, while I'm doing my A-levels, it's sixth form, homework, you know, either training or not training or training, come back, do medication and things like that. So you just have to kind of think ahead before you organise your day, I suppose. I think when I was younger, you know, I knew everything was going on, I knew what I had, I knew what it meant, but like I hadn't really had the experience, whereas now I'm older, like I have had infections, I have been an inpatient in a hospital, and I thought, oh, hold on, you know, this could, well, this is there, it is present, it is something to consider. So yeah, definitely, as I've got older and got the experience with it, I think, well, yeah, I really do need to keep on top of it, because otherwise, yeah.
And so what are your plans for once you've done your A-levels? Do you want to go to uni?
Uni does really appeal to me, if I'm being honest. I don't really know what I want to do specifically. I have a general idea. I'm just going to try and get as qualified as possible, and you know, see where I go from there, type thing.
And do you think having CF would affect where you would apply to go to uni?
Well, yeah, because at the moment we live in Essex and London. They've got a lot of good hospitals in London, and so that's quite easy to get to. But if you know there was a university in Manchester, if you're up in there, it would be, you know, you'd have to relocate hospitals and things like that, and your files would have to get sent up and things. So yeah, it does. It is a consideration, yeah.
Regardless of having CF, what do you think is the most stressful thing about being a teenager?
Balancing a social life, education, homework, and everything, all trying to fit it into one day and trying to make sure, you know, nothing gets forgotten and nothing gets, just balancing it all out, making sure you do everything.
Yeah. And how are you feeling about transition? Is that something?
Yeah, and it doesn't really faze me. I don't want to come off overconfident, but I've been able to talk and communicate with doctors and nurses and physios quite well, because I've always found it interesting. I've always asked the questions. I've always wanted to know what's going on. Yeah, so I've always been there speaking to them, not sitting there on a phone or whatever, while you let your parents do. That's the thing. So yeah, I was well equipped going into the adult part of things.
And what about cross-infection? Does that have an impact on you?
Yeah, with cross-infection, I remember talking to the nurse at school about things. So I had to ask her if there were any other patients or people with cystic fibrosis within the school. I think there might have been one, I believe, but no, not really. It's never been a thing. I've always they've not been around me really, and I've never spoken to anyone with cystic fibrosis or anything like that.
Okay, so you don't chat to people with CF online or anything like that?
No.
If you wanted someone who doesn't know anything about cystic fibrosis to know about it, what would be your sort of main thing to tell them?
That is just a little anecdote. In A-level biology at the moment, the whole topic 2 is on cystic fibrosis. Yeah, and so they're reading things like, I know for some people this is the case, and like the average life expectancy is 40, you have chronic diarrhoea, you know, they're not often small and they have to spend a lot of time with their physio. Yeah, sometimes with people that is the case, but for me it's not. And so I don't want anybody running around thinking that I have chronic diarrhoea and the pity if I'm going to die at 40 and things like that. So I'd say it's not always, you know, there are exceptions to the rule. It's not always, you know, what it says on the paper, if you know what I mean.
And if you wanted to give a message to younger people with CF, would you have anything that you'd like to say?
Stay as active as you can, I suppose. Take up a sport. I mean, I was in the position where I could play rugby. I was never good at it. I'm still not the best at it, but yeah, I enjoy it, and I'm at the stage now where I quite look forward to going and things like that. I mean, I've in the past I've been like, I don't want to go rugby, mum. I can't be bothered. They're all better than me. But I just kind of kept with it, even through education, and I'm really enjoying it now, actually. Yeah.
And do you find it helps with things like your physio?
Yeah, definitely. Physical activity will help with the physio, and also the social side of it. Make a few new friends, I suppose.